Hello, and welcome to the second learning objectives, where we'll be talking about theories of justice and equity. So, let's start by kind of framing justice in a way that kind of sets the pace. Justice in healthcare focuses on fairness in terms of delivering healthcare resources and looking at services and also opportunities that ensures that ethical decision making is happening, and decision making is being as impartial as possible. So the aim of justice in healthcare is to try to remove disadvantages that are caused by factors like race, income, geography, and a couple of other social determinants of health, or arbitrary factors. So, justice tries to ensure that policies and practices are upholding ethical principles that are specifically trying to address the disparities in terms of healthcare access and in terms of health outcomes. We're going to talk about this in more detail, but just to give you an idea of what that means. So, with equity in healthcare, equity is more concerned about addressing systemic barriers that prevent populations from achieving equal healthcare opportunities. So, just a refresher in understanding what we mean when we say equity and how equity differs from disparities. So, with equity, we're saying not just that disparities exist, but there has been systems that have been put in place, unfair systems that have been put in place to ensure that these disparities exist. And so that is how we view equity and how we separate that from inequality, or how we separate that from health disparities. So equity in healthcare tries to address those systematic frameworks that have been put in place, those unfair barriers that have been put in place to make sure or that creates these disparities that then result. So, equity in healthcare focuses on tailoring resources and efforts to meet the specific needs of marginalized or underserved groups, and it does this by tackling structural inequities that were caused by things like socioeconomic status, historic this injustice or injustice, and tries to address discriminatory practices. All of those things that created the unfair barriers that then led to these disparities in healthcare health outcomes. So, equity and justice in healthcare, what they do is that they ensure that health systems are prioritizing reducing disparities and are addressing social determinants of health because of how much these play a part in healthcare systems. So they create a framework that tries to balance universal fairness with targeted support for vulnerable population, while working towards ensuring more inclusive health outcomes for as much for everybody, ideally. So, there are a couple of different ethical theories that we're going to discuss for this class. We're going to look at utilitarianism, we're going to look at justice as fairness, we're going to look at libertarianism, we're going to look at egalitarianism, and then finally, we're going to look at capacity approach. So, we're going to discuss this in terms of a definition and explaining what that theory or that framework is, and also look at it in terms of public health applications of it, and then some of the criticism that has been made about these frameworks. So, starting with utilitarianism, it's rooted in the principle of maximizing the overall benefits for the greatest number of people. So, the public health interventions that are rooted in utilitarianism is going to be focused on getting the highest measurable outcome, and they will be measuring this outcome based off from using tools like cost effectiveness or some statistical metrics. Just to explain it a little bit for anyone who is unfamiliar with tools like cost effectiveness, let's use, for example, a state has $10 million to do health intervention, and it's going to cost $5 per person. to do, if it's going to cost $5 per person to get that 10 million done, versus if it's going to cost sorry, $5 per person and it's going to reach 1,000 people, for an example. I know my math is all wrong, but just to give you an example. So, and then it has a program that is going to cost $6 per person and is going to reach 3,000 persons. So the $5 per person that is going to reach 1,000 people is going to cost you less money, but $6 to reach 5,000 people is going to cost you more money. Utilitarianism is going to prioritize the $6 per person that is going to reach 5,000 people, because it's not just going to look at it in terms of the base amount of money, but it's going to look at it in terms of how many more people did we reach in terms of our intervention, and what does that mean in terms of how, not just the help that we get now, but the help that we're going to get, say, in 10 years, because we have now been able to reach 6,000 people versus reaching 1,000 people. So even though we're spending more money to reach 6,000 people, it is better than spending less money just to reach 1,000 people. So that is the approach of utilitarianism. So it's very, very central to resource allocation during public health crisis, where the focus is, let's try to get as many people to be well as possible, or in situations where the resources are limited, and whereby even though we're going to spend more money, we're going to reach more people. And because we will not be able to achieve the same thing if we're only reaching fewer people, or natural disasters and stuff like that. So that is utilitarianism, is kind of focuses on having to get the most number of people taken care of, even if it's going to cost slightly more money. Not to say that every time is always going to cost more money, but the focus would always be what is the maximum thing we can get out of this. In terms of decisions on how we are putting resources together. So utilitarianism tries to balance health benefits with economic efficiency, trying to ensure that societal health improves with minimum waste. So 1,000 people that is getting, my math is off here, but just bear with me. 1,000 people, of which they're spending $3 million, for an example. If we are going to take care of 5,000 people, we are going to need far more than $3 million, or far more than $5 million that it would have cost us to take care of 5 million or 5,000 people, even though it's costing at $6 per person. So that is kind of trying to get the sense of that. I know my math is off, but just have an idea of what it is that I mean. So it will look at it is, if we were to reach 5,000 people with this, if we insist on reaching 5,000 people versus what is going to cost us $5 to reach 1,000 people, we're going to end up spending more money. So it's going to look like waste versus spending more money just to reach more people in terms of that. I hope I'm not confusing you guys. If I am, I'm so sorry. So yeah, so utilitarianism offers clear guidelines for prioritizing interventions to deliver the most significant public health benefits, because tools like cost effectiveness, cost benefit analysis, and cost utility analysis are all tools of economic evaluations that have existed for a long time and have been evidence based. So it's very, very easy to defend your reason for putting in your money in those interventions, because you have the numbers that you can just crunch, and we have numbers that come out and say, hey, we're going to end up spending less money in the overall, or in the long term, because we are reaching more people. So that is why it's very clear guidelines when it comes to utilitarianism. So it ensures there's effective use of limited resources. It's very easy to budget based on utilitarianism, because we know this is the number of people that we want to provide help for, and this is how much it's going to cost per person to provide this help for. So it's a lot easier to use to in the place with limited resources to make those decisions based on the utilitarianism framework. So these are some of the public health population health applications of utilitarianism that you guys can just read up. So there are a couple of criticism that's been leveled on utilitarianism. One is that it overlooks smaller populations with unique needs. Example would be people with rare diseases or rural communities. In a situation whereby there's a limited resource and we need to spend it on rural communities versus urban communities, usually the urban communities has more people versus rural communities. Utilitarianism is going to focus on where the most number of people are versus the less number of people, which means that people in the rural communities are going to end up being overlooked because of the framework that utilitarianism leans towards. It also creates ethical dilemmas in terms of how are we prioritizing collective outcome versus individual rights. An example would be in vaccination, whereby the argument would be if we get herd immunity, that is what counts versus someone feeling I don't want to get vaccinated, I don't want to get foreign objects into my body sort of argument. So utilitarianism is going to choose herd immunity over individual rights, the person saying I don't want to get vaccinated. So that is some of the criticisms of that framework. So it also struggles to incorporate less tangible outcomes like mental health outcomes or quality of life. I'm going to use an example of, let's use for example, we want to spend money on either a diabetes prevention program versus a diabetes management program, whereby with diabetes prevention, we know we're trying to get so that there are fewer people who are diagnosed with diabetes type 2, and with the management is fewer people who are able to, let's use for example, have better quality of life. Number of people who are not diagnosed with diabetes type 2 is a more measurable amount number than people saying they have improved quality of life. I don't know if that kind of makes sense. So it's a challenge with utilitarianism that has to make that decision in terms of we want to have fewer people not get diagnosed with quality of life, and it may do that by overlooking the quality. Sorry, we want to focus on fewer people not being diagnosed with type 2 diabetes, and it to do that at the expense of people who already have type 2 diabetes having lower quality of life. I don't know if that makes sense, but yeah, but that is how that goes in terms of the criticism of utilitarianism. So going into the second theory, which is justice as fairness, this is rooted in John Rawls' principle of justice. This theory emphasizing reducing inequalities and prioritizing the need of the least advantaged members of the society. It's advocates redistributive policies, all about promoting fairness, ensuring everyone has equitable to essential health services, regardless of their socioeconomic status. Healthcare, under this theory, is framed as a moral obligations, and this theory focuses on reducing structural barriers. And looking at those historical disadvantages that created those unequal opportunities to health by making it such that it creates equitable opportunities to health. So it tries very, very hard to seek to bridge the gap between marginalized populations and the general society. So this theory focuses a lot on marginalized population, with the aim being how do we make it such that they are less marginalized and they have equity at opportunities to health as it is with the general society. There's a whole lot more, so much more emphasis on vulnerable populations that have been overlooked by public health strategies. Example would be racial minorities, rural residents, and low income individuals. So these are some of the public population health applications of fairness as justice. You guys can read that up. Just like utilitarianism, there are criticisms of this theory. One is the how do you define who the least disadvantaged population is? Because it's very, very complex. Do you define it based off on culture, geography, socioeconomics, context, and stuff? So, with the social determinants of health, many people are having to deal with multiple social determinants of health that make them more disadvantaged than others. You could have someone who is black, woman, disabled. Already, they are dealing with three social determinants of health that are making life difficult for them. They could also be, not have high education, in which case you're dealing with four, or they could also live in rural areas, in which case you're dealing with five. There are five social determinants of health that are making this person have lower health outcomes to, let's say, the general population. How do you determine who is the least advantaged? Does it have to be the people that have the most number of social determinants of health that are counting against them? But if you're using that, what if by the end of the day you're only dealing with just a handful of people compared to the general society? Does that justify focusing on them versus the general population? So those are some of the criticism of fairness as justice. Also, the redistributive policies of justice as fairness does face significant resistance in societies that have the sort of anthropological values that the US has in terms of individualism, personal responsibility, freedom of choice, and where you have market-driven healthcare system. So it does face significant resistance in terms of that, situations where you have people calling it socialism, when it comes to public debates. So equity focused policies also they can conflict with efficiency. Just like I mentioned before, how would you make the argument that let us give the most attention to, let's use for example, 5 million people that have the most number of social determinants of health counting against them, against 900 sorry against 290 and 90 million people. What's the argument for saying let us focus on this 1 million people and to the detriment of 290 million people? Because a lot of the times they have a lot there's so much more resources that has to go into trying to get their access to healthcare to be equitable to the general population. And if you don't receive that much resources, in terms of the improvement in health outcome may look like it's not significant. For let's use, I'm going to use an example. If one person just needs to live in a house that doesn't have a lot of roaches and doesn't have a lot of rats, but they have a job, they have some form of health insurance, and they can feed themselves reasonably. That's one person. The other person does not have a house at all, does not have a job, does not have any insurance of any type, and has dependency. The amount of resources that needs to go with the second person is so much higher than the first person, and it's going to take a longer time to get the second person to have the equitable access to services than the first person. So that is an argument in terms of how do you justify spending so much resources on, for example, person two, if the outcome that you're going to see in improvement in healthcare is going to be lower than how much you will spend in person one and see a higher improvement in health outcomes. So that's some of the criticisms of this theory. So the third theory is libertarianism. I'm sorry, listen up my words. So, this theory emphasizes individual autonomy, freedom of choice, limited government involvement. You can already tell this is how the US mostly operates in. It treats healthcare as a personal responsibility and not a societal obligation, and a lot is being fueled by the market-driven solutions. It advocates minimal regulations. It encourages competition, innovations, as a way to drive quality improvement and to reduce costs. So healthcare decisions are seen primarily as personal responsibilities. So it allows people to make the decisions whether to opt in into a tele service or opt out of it. It allows for multiple choices in terms of insurance plans and choosing treatments that align with their preference. So, it encourages innovations that I've already said. So there's a larger respect for individual autonomy, and it also promotes a personalized choice in terms of patient preference and financial capacity. So this is some of the applications of libertarianism in public population health. That's you just have a quick look and just read that up. They like just like all the other theories that I've discussed. There are criticisms about libertarianism. First is that it fails to address systemic barriers in healthcare, healthcare delivery, healthcare access, and therefore vulnerable populations are more at risk of being excluded from healthcare due to having financial constraints. So the market-driven model widens disparities that already exist by pushing more high-quality care among people who can pay for it or who are willing to pay for it, and thereby leaving people who are low income to have less options and less access to healthcare. So it also lacks a mechanism to address collective crisis because it really de-emphasizes social determinants of health. So in situations where there are pandemic, it does not encourage for coordinated actions because, like I said, there's a lot more emphasis on individual responsibility. So trying to get everybody to collectively work together to achieve a goal is more difficult under libertarianism. So we have egalitarianism. It's this views healthcare as a fundamental right. It's very similar with John Rawls's justice as fairness, in the sense that it emphasizes it views healthcare as being a fundamental human right, and it also tries to make it focuses on getting healthcare towards the people that need it the most, in having to not focus on people's ability to pay. So, and it aims to reduce disparities by ensuring access to essential services to all persons, regardless of whether they are able to pay or not. Just like justice as fairness, it views healthcare as a public good, as a social obligation, and therefore advocates for policies that try to reduce financial and structural barriers to health. Also tries to address equity as well. So it promotes redistribution of healthcare resources to ensure more equitable access across different populations. Very similar to justice as fairness. It strives to ensure that everybody has equal opportunity to healthcare outcomes as a way of fostering a sense of fairness. So it promotes public health by emphasizing preventive care. There's a lot of promotion. There's a lot of emphasis on preventive care, primary care, under egalitarianism than all the other ones. So As I've mentioned, there's a lot of similarity between egalitarianism and justice as fairness. In the sense that they both focus on equity, they focus on healthcare being seen as a public good, as social obligations, and they really focus a lot on redistribution of healthcare resources. Where they differ is that egalitarianism aims for equal outcomes for everybody. Its focus is, let's get everybody to have equal health, have good healthcare outcomes. Justice as fairness, on the other hand, is willing to sacrifice inequalities if it improves the healthcare or the situations of the least advantaged people. So that is the difference between them, in the sense that egalitarianism is more or less, let's get everybody to be well. Is very kumbaya in its approach to healthcare. Justice for fairness is more of the people who need it the most should get the most, even if it's at the cost of the people, of the other people. So that's the difference between them. So this is some of the population health applications of egalitarianism. And just like all the other theories, there has been critics of this theory. First is that it requires substantial government funding, administrative structure to make sure everybody becomes well. It's very, very kumbaya. Trying to get everybody to agree to all be kumbaya is a bit more difficult, and gets have more requires more funding. So it does face significant political and financial challenges. So uniform policy is not very likely going to be the same as everybody else. If, let's use for example, if I need $1,000 to be able to live a good life, and another person needs $500 to be able to live a good life, if we are all given $500, one person has their needs met, the person who only needed $500. I, on the other hand, who needed $1,000, does not have my need met. So there is really no equity in this case. One person is still left disadvantaged, which is the person that needed more. So that is one of the criticisms of egalitarianism, because it just focuses on uniform policies and ignores some unique differences that exist within diverse populations. So, and also critics argue that egalitarianism may reduce incentive for innovation, because it's all about, let's get everybody to have the same thing, and it does not encourage trying to do more in the way that libertarianism does, for instance, because it's the focus. Libertarianism is trying to get people who can pay for things to pay for it. Egalitarianism is not operating in that wavelength, and therefore it does not encourage people to do more, to go the extra mile, just to get the extra amount of money that they're going to get from people who can pay for it. So that is one of the criticisms of egalitarianism. And then finally, with the theories, the five theories, and we're discussing for this module, is the capacity approach in healthcare. So this approach emphasizes enabling individuals to achieve essential capacities for well-being, and it kind of looks at healthcare as with the aim to address social determinants of health in general. And it's saying that in order to empower individuals to live a fulfilling life and not just focus on treating illnesses, you have to address the social determinants of health that creates this illnesses, or that exacerbates these illnesses. So it advocates shifting the focus from healthcare access alone to trying to address broader societal conditions like education, housing, and stuff. All of those things that influence healthcare, by saying, if we want to get healthcare to become good, we have to take care of all those things that influence health outcomes. So it encourages health systems to integrate with other sectors to address those non-medical barriers to health. In this way, it creates long-term solutions to healthcare. So it's all about a holistic, flexible framework that focuses on interconnectedness between social, economic, and health factors. And it does focus on trying to do it in such a way that there is long-term empowerment and systemic changes in health systems rather than the short